The symptoms that you'll see look a lot like all of the other stuff that we see constantly. Mold can be very, very tricky. It can be hard to see, it can be hard to diagnose. Now the good news is Dr. Dennis is going to give you some awesome stuff that you can do from the moment that they walk into your clinic that can really help you out. Because he's figured those pieces out. The system, the way it works here, every single one counts as 1 point. CIRS criteria is met if they've met at least 8 out of 13 for adults and 6 out of 13 for kids. Now all this tells you is that you're dealing with a biotoxin-based illness. This does not tell you it's necessarily mold. You just know you're dealing with a biotoxin. Okay, so that's super critical. Because I have dealt with some other patients that have had environmental toxin related exposures. Initially we thought it was mold and we had to dig deeper and figured out no, there was actually some other things going on. They do impact the gut, and it is the birth of autoimmune disease. And the way we see that happening is we see environmental triggers, we see a loss of oral tolerance. These patients start developing and kicking off new allergies on you, new intolerances to new foods that others would call allergies. The gut microbiota changes. One of the most important products to get on board as quickly as possible is that ion biome that you heard Zach Bush talk about. That was a major game changer for my family and actually saw restoration of cognitive function with working on that microbiome right off the start, okay? There's many different ways that we can start intervening in that environmental component and some ways that we can start bringing some protection in there. What you're seeing here is a piece that was commented on by Dr. Jill Carnahan. You can see that if you get them on zinc, vitamin D, vitamin A, some probiotics, some L-glutamine powder, and some Restore, now known as Ion Biome, you can actually get them to start holding ground. These people are hugely demineralized. They're also going to be full of heavy metals. But metals and mold always go together. So that's part of the reason why we have to be really careful about, as you know, do the restoration first before we start doing that detox process on them. Okay. So here's the key from the environmental side on the physical component. Gotta have clean air, clean water, clean diet, clean products. Then we transition into one of the most critical components possible. Clean thoughts. Hold every thought captive. This is a neuropsychiatric condition. Reactivity can be dramatically changed purely based upon their thought life. And I figured that one out the hard way by watching my kids go through it. And I found that I was feeding into their thought life negatively when I would speak about mold. So this is the patient that while you feel like you're speaking with forked tongue, we need to get you away from the mold, you need to do this because of the mold, you need to do that because of the mold. Oh, by the way, stop thinking about mold. You want to move them into a clean environment as quickly as possible and then rapidly shift that thinking. And boy, it can be a challenge because they really do get stuck in a limbic loop. These people are stuck in sympathetic. Man, they are so convinced the bear's just going to kill them any minute. And they are constantly stuck in that sympathetic. Your job is to get them over into parasympathetic. And the first thing you have to do is pull them off the cliff and let them know that they can and they will heal. If you have patients that have healed, put them in touch with them. These are people that need a support group. Do not send them to Facebook for their support group. The fear and the terror in that environment will drive them 180 degrees in the wrong direction. So one of the things that we really need, and one of the main jobs I find myself doing now as an environmental health consultant, and I'll work with any practitioner, is they have to have safety in their sleep.